Are you a family caregiver caring for a loved one in your home? Are you exhausted, worn out, and at the end of your rope? Do you feel like giving up? If you desperately need answers and direction on how to take care of your loved one, you need Caregiving Tips A to Z. This highly informative book by Starr Calo-oy has been written in a down-to-earth manner rather than in technical language. How does she know what you need to know? Because Starr and her husband Bob took care of the elderly in their home for 18 years, 24/7, 365 days a year. They've been through the sleepless nights, behavioral problems people with dementia have, and trying to get the elderly to eat. They have been through it all, and now they want to share the hands-on tips they've discovered over the years with you. Call Starr now for your copy of Caregiving Tips A to Z and start living again. Call 521-8668. That's 521-8668 and talk to Starr. Remember, you're not alone anymore. Call 521-8668. That's 521-8668.
Pretty good tips, though, and she chatted with Eileen.
And Starr Calo-oy is back with Caregiving 101. You got a lot of good tips, and you also have some great tips on oral care, which is so important.
Yes, it is. Well, if you can imagine, if you were no longer able to brush your teeth at all, Eileen, how hard that would be. If you couldn't even verbalize, would you please brush my teeth for me? And how difficult that is for the individual that can't communicate it. So what we suggest is some certain kind of tips so that makes the brushing easier, because it is kind of an awkward thing to do.
It really is. You know, and it's just as when we are children, we should actually kind of reteach our parents. Is that right?
Yeah, that's absolutely right. What you might do is, if they absolutely don't have a clue and they have dementia, for example, what you want to do first of all is, I always go back to the same thing, cover your mirrors in the bathroom, because it can be frightening to them. To begin with. That's very important. They think it's somebody else that's in there. And so you don't want to bring any confusion in. So if there's a way for you to please, you know, just try to you know, cover it, that would be the best thing if they're ambulatory or if they're sitting in the wheelchair. And then what you do is, if they're not able to brush them themselves, take their hand and help them and kind of guide them and talk as you're doing that. That's good to talk about something cheerful and everything. And it doesn't have to be perfect. We aren't looking for perfection. We're just looking to clean their mouth.
Yes.
Now that's one type. Now let's say that they're not able to get out of the bed. You can purchase these little trays that you get from any of the pharmacies or medical equipment supply companies, and have that on hand so that you can brush their teeth in their bed. If they have dentures, you want to soak them, clean their dentures, and if they don't wear their dentures for quite a while, then their gums are going to shrink and they're not going to fit. So don't force them. Don't force those little choppers back in there. You don't want to do that.
I'm also reading from your tips, brushing in the shower. Is that also convenient?
Yes, it is. If you're going to be bathing your loved one in the shower, then have everything laid out and ready so you can help them brush their teeth there. And that way they get it all done at once, and then they get out, because it's less messy for you.
If your loved one needs assistance, how do you approach them? How do you let them know?
Okay, well, one, you want to preserve their dignity. That's very, very important. You want to come up to them if they need, you mean if they need any help?
Yes.
Right, brushing their teeth. Well, Mom, do you mind if I help you with this? I know this is a little difficult for you right now. Why don't you let me help you with this? Let's see how much you can do by yourself, and then I'm going to help you with the rest of it, okay? And I'm going to be very gentle and be very careful with you.
Talk them through it. Yes.
And smile as you do it.
As you do it, as you approach them, I'm sure, as you talk to them about wanting to do it. And really, as you mentioned, preserve their dignity, because they are still your loved one, and they are still somebody who just needs a little bit of assistance.
That's right. And also, all antiseptic that you can get from his dentist, mouthwash for if you're not able to do a superior job. Keep an eye out for little sores in the mouth, because many times they're not able to verbalize that as well. It can lead to an infection. Bad teeth can lead to an infection. It can cause all kinds of problems with their metabolism and as far as their body temperature. Can you imagine that leads to that? So keep an eye out for everything. Keep their mouth clean. Use toothets. Toothets are a little sponge at the end of a little stick that you put in the water, and then you can sponge their mouth out if they're getting close to passing away. You can use that as well.
Okay, so some great tips to keep in mind. Do not expect him or her to rinse in the later or latter years of dementia.
That's right, exactly. They cannot understand how to swish and spit, because what they'll do is they'll swallow. They'll just swallow it.
Yeah.
So don't get all upset about that. Remember, you've got to have a paradigm shift here, and you've got to bring yourself down to their level, what makes them comfortable. Don't strive for perfection. That's the most important thing.
Yeah, you can't swallow toothpaste. It's not good for you.
Yeah, exactly. You're not going to be saying that. There's a lot of natural toothpaste that you can get at the health food store that are fine to swallow. And then we have the nail care as well.
Okay, exactly. And so we've got a lot of great tips in all your books, Caregiving Tips A through Z, 2 different type of books. As always, go ahead and give them a call or log on to this website. Now, in Caregiving 101 with Starr and Bob Calo-oy, if you missed it here, you can always tune in to KKYX 680 AM every Saturday morning at 8 in the morning. Thank you so much, Starr.
Okay, see you next Sunday.
All right.